Want to welcome you here to an A4C panel discussing cannabis and mental health. My name is Nate Jackson. I am an original founder of A4C. And with me today, we have an awesome panel. I'm going to introduce you guys. I'm going to talk a little bit about my story. And then I'm going to ask each of the panelists to discuss their story or just an opening statement in regards to cannabis, mental health. And from there, we'll kind of springboard into the conversation and see where it goes. So with me on this panel today, we have Ali Stoddard. She is the owner at Green Valley CBD, and she is an A4C ambassador. Also with us today, Dr. Blake Pearson. Blake is the Chief Medical Officer at Pearson Health. And also with us today, Dr. John Murphy. Dr. John Murphy has a private practice. He is an adult psychiatrist, and he's also an ex-athlete. So a lot of relevant players today to talk about cannabis and mental health. I'm going to give you a little bit of my background. Like I said, my name is Nate Jackson. I played in the NFL for 6 years, and I'm now a writer and a radio host here in Denver. When I was a kid, I was a very hyper, rambunctious child, always getting in trouble. I would probably be a perfect candidate these days for medication for a hyperactive kid. Now, I grew up in the 80s, so that wasn't part of the equation there. It was just, I was a kid who was hyper. They dealt with me. I got in trouble in class from time to time. I had a lot of energy. I played a lot of sports, but I never had any pharmaceuticals. And when I was in high school, towards the end of, well, actually around the middle of high school is when I first discovered cannabis. Now, of course, it was illegal back then. And so when you discover that as a kid, you got to keep it a secret. It was a secret to everyone but me and my friends. But what I discovered when the first time I ingested cannabis was it made my hyperactivity that was natural to me kind of come down a peg and made me relax. That was the first time I was like, this is something. Although in high school, it was recreational. In college, I started playing football and being very serious about football. I played football in high school as well, but in college is when the real football started for me, and with it came the injuries. So in college is when I discovered that cannabis could also be used as a medication. I was dealing with a cracked rib. I could barely breathe. I could barely laugh. I was having a hard time. I ingested a little bit of cannabis, and I found some relief. Now, I made it to the NFL, and in the NFL, you get tested for cannabis. So in the NFL, I didn't use much of it because I was worried about getting caught. Now, in the NFL, there's a lot of injuries. There's also a lot of stress. There's also a lot of pain, not just from injuries, but off the field. There's some depression, anxiety that really never gets addressed. And the way that teams deal with pain in the NFL, here's some more pills. So early in my career, I took those pills, and they didn't really work for me. I felt yucky when I took them. I didn't sleep well. I got depressed. I got down. I felt like I healed slower than I would have had I been doing it the natural way. At the end of my career, I started to realize, there's something else that helps me heal faster. That helps me rest. That helps me sleep. That helps me have a better overall mood and outlook on my life and my ability to come back from this injury, and that's cannabis. Still, it was a secret, so I couldn't share it with anyone. It wasn't until my career was over that I started talking about this stuff. And it was important that I did, because in that transition in a career for a professional athlete of any kind, it's a very depressing process to go from being on a team, having a purpose, to all of a sudden being alone, without a team, without an itinerary, a long list of physical maladies, a little bit of money in the bank, nothing to do, and nowhere to go. The depression kind of follows that. And so it was through the realization of that, what I was going through, that I started meeting other like-minded individuals who are leaving athletics and dealing with the same stuff: pain, depression, difficulties controlling mood, loss of purpose, things like that. So through that, we started A4C, and here we are today having these sorts of panels. That's my story. That's where I come to this. Ali, could you tell us how you came to the cannabis space and what your thoughts are on this topic?
Sure. So I was a D1 athlete. I swam for Cal, played rugby. And I was a surgical consultant in the operating room for 25 years. So I worked with physicians, surgeons, osteoporosis, orthopedics, neurosurgery, you name the surgery, I've been in it. And I realized that the human body is an amazing vessel that Western medicine was chopping up and giving pharmaceuticals to. And I came to cannabis. Basically, I just felt like there had to be another way. I had heard about homeopathy. I wasn't really interested in herbs, and found cannabis in 2015 and started my own company. So I've done a lot of working with the plant and patients. And so I own a company, greenalleycbd.com. I'm taking cannabis out of the back alley and turning it into a green oasis of healing.
I like that. Very nice. Thank you for sharing that. I look forward to talking more with you about that stuff. Dr. Blake, tell us about yourself and how you come to this cannabis game.
Okay, so on the athlete side of things, once upon a time, played a little junior hockey and drafted to the OHL back in the day.
Look at you! All right.
there's my athlete story, and obviously didn't take hockey to that next level. Had to focus on the books, so I went to med school, and I'm a primary care physician by trade, but I've been specializing in cannabis medicine for about the last 5-6 years. And when I say that, it's a little different in Canada where I practice. I'm also board certified in the US, but I practice in Canada. And we actually at our practice will prescribe specific amounts of CBD, specific amounts of THC for a given condition, which is a little different than the American model where you kind of walk into the dispensary and kind of shop around. We're really targeted dosing. And with that comes a number of conditions that we manage at our clinic. We see patients with chronic pain, of course, mental health, which we're going to touch on tonight, variety of mental health diagnoses, whether it's generalized anxiety, PTSD, sleep disorders. But then in the practice, CBD and THC can be used in other diagnoses. So we treat a lot of dementia patients with reducing their behaviors, and also pediatric patient population with rare seizure disorders or severe autism. So yeah, it's interesting how the practice really treats patients from kids to aging adults, which shows you how versatile cannabis medicine can be.
Yeah, so there's really no one who can't, in the right situation, benefit from cannabis as a medicine.
Yes, in the right situation. Yeah, exactly. With
Right.
like a specific diagnosis. Yeah, there's a number of patients that can benefit. We don't kind of classically cannabis. It's such a wonderful plant, and there is some benefits to even what we call kind of healthy normals who don't have specific diagnoses, but clinically we focus on patients with specific diagnoses.
Good. Looking forward to getting into that and the healthy normal stuff, because I think that's important for everyone to learn about as well, because it can actually provide benefits to healthy, normal individuals. Dr. John Murphy, tell us about yourself.
Okay, I'll be brief. All right, I was a swimmer throughout my life.
Well, we got you and Ali are both swimmers. I was a swimmer as well. We got 3 swimmers here out of 4. Yeah.
I was just in a pool before this panel, so there we go.
Well, we got 4. We got 4 swimmers. What are we talking about? All right, Dr. Murphy.
Okay, I spent 25 years practicing psychiatry in Beverly Hills, but not exactly psychiatry. I was a doctor approved to do human drug research. So I've done over 300 double-blind placebo-controlled trials using psychotropic drugs in human beings, testing for the FDA and the government and big pharma. I know a great deal about the brain, about various mental disorders. I've spent my life researching these disorders and drugs used to treat them. I stumbled upon marijuana. I was in California And to make a long story shorter, I bought a farm and started growing my own, testing my own, and I found marijuana to be more beneficial than almost every drug I'd ever helped develop. I could cure more disorders with marijuana, so I began to research marijuana, which is very difficult because it's illegal in the United States, well, almost around the world, to study cannabis the way I studied pharmaceutical drugs. But nonetheless, I know a lot about how cannabis works in the brain, how it works in the body. And yes, it can be definitely used to treat pain and all types of psychiatric issues. And yes, it can help so-called normal people as well. And I'll just answer questions as they come.
Sorry, guys. Sorry about that. I lost my my Bluetooth there for a moment, so I'm pulling those out. Okay, so looking forward to getting into the details of those studies, Doctor. But I wanted to circle back to you, Ali, and talk about CBD a little bit, because we hear CBD a lot. We don't know what it is. Tell us, what is CBD, and is that enough to treat some of the issues that people have going on right now?
Well, CBD, or cannabidiol, is a bioactive component that you find in the cannabis plant. Cannabinoid, endocannabinoid system is something in our body that is looking for cannabinoids. So CBD is one of the main cannabinoids in cannabis. THC being the other one, which is more psychotropic. And CBD is non-psychotropic. It's psychoactive. It will work on the brain activity, but it's not, won't get you high per se. So
when you say, Doctor, when you say, Ali, that the endocannabinoid system is looking for cannabis or cannabinoids, how do we know that? What does that mean?
well, what we're finding in the last couple of years is that we have something called a dysfunctional endocannabinoid system. And when they were researching Dr. Meshulam way back in the 90s, they found this system, very pervasive system through our body, kind of like the immune system, but even more pervasive than the immune system. And they've got these receptors or targets all throughout the body, and the skin, all of our organs. And the CBD is one of the compounds that they know actually jumpstarts or strengthens or wakens up this system. And so really it's not the THC or the CBD molecule, it's this endocannabinoid system that's actually doing a lot of the work per se.
So it could be deduced that whoever created cannabis created it to specifically bind to those receptors in our body.
Absolutely.
Okay, and
there are more brain receptors, there are more endocannabinoid receptors in the brain than all of our other brain receptors combined.
So talk a little bit about the products that you have and what effects those have on patients or people you deal with.
So I've gone out and looked at a lot of different companies' products. I have some of my own products. I'm developing something for COVID, for vaccine injuries, but what I look for in a product is I look for how clean it is. And so all of the CBD that I work with by law has to come from the hemp plant. So in the cannabis industry, there are two plants: the marijuana plant that has CBD and THC, and of course some other cannabinoids, and then the hemp plant, which historically has been used for its fiber. And then in the last 5-10 years, they've realized that they've got a large amount of CBD in the hemp plant. So I work with only hemp. And so all of the products, I have like a tincture that's wonderful for jumpstarting this endocannabinoid system. And so you say, well, what product is good for what patient, is good for what disease state or symptom? What we're doing here is if we can get CBD into the body, it's going to start this endocannabinoid system to work. And so I do a lot of secondary things, like I look at what are the CB1 receptor, what's an agonist, or what will turn on the CBD receptors. What botanical can we add in with CBD to actually calm the nervous system or calm the hormone? So I've got a product that's got CBD and ashwagandha and CBD and boswellia. Boswellia is excellent for joints as well as the CBD. So all different strains and things, and botanicals, topicals, you name it, it's all out there. And I think what's important is that you have a clean product that's been tested, that doesn't have added chemicals or synthetics. And as we all know, cannabis is not the best tasting. So to find an edible that's actually tastes good is hard to do in a healthy, non-chemical way.
So Dr. Pearson, I want to move over to you a little bit. You are a family medical practitioner in Canada, and you're able to prescribe cannabis and dosages to patients. Can you talk a little bit about that process from a medical standpoint, from an efficacy and a safety standpoint? How do you know that the cannabis products you are prescribing are grown safely, are grown in a healthy way without pesticides? How do you monitor dosages? Cannabis is a living plant, right? So every plant conceivably is different. How do you determine that you're giving the patient what they need when you prescribe them cannabis?
So Allie brings up a good point in that testing, right? Lab tested. So whether it's her product or a Canadian licensed producer, testing is imperative. So at home, everyone is on a Health Canada lab tested product. So that's number one. So having that can't be stressed enough, because there is kind of a number of different markets, let's say, for CBD. Like in the US, you can go into a gas station and find CBD, and half the time there won't even be CBD in there. It could be labeled incorrectly, could have THC in it anyways. So when we're working with patients though on dosing, really it's about starting low and going slow. So we start them with small amounts, usually 5-10 milligrams, and we'll titrate up slowly. Depending on the diagnosis is when we'll manipulate higher CBD, or maybe if it's a sleep disorder, we'll use more THC dominant oils. We're usually using the oils or capsules, again, lab tested. And with that, exact dosing. So all of this stuff is tested. So when a patient takes 1 milliliter and it's a 10-10 concentration, they're exactly getting 10 milligrams of THC, 10 milligrams of CBD. So that's what's nice about having the regulated market, where we're seeing probably the best benefits in mental health. On the anxiety side, again, not just kind of smoking a lot of cannabis to manage anxiety, but perhaps using CBD during the day to manage symptoms, sleep issues at night, use some THC. PTSD symptoms are responding. So it's one of those things though, and I think everyone as clinicians here can relate. It certainly isn't a fix-all for all mental health diagnoses. So Nate, it can certainly help for the right patient, but there are also patients who may not respond, and that's important to point out too.
Okay, talk a little bit about why or why not it might work for a patient. Some people believe that, hey, all I need to do, I'm not feeling well. I'm anxious. I'm depressed. I'm going to sit on my couch and take bong rips. It's going to make me feel better. I'm still going to eat the same way, poorly. I'm not going to exercise. Talk about kind of a total health, total wellness perspective to using cannabis in an efficacious manner.
Yeah, so that's a great point. And when we're talking in mental health in general, there isn't that one size fits all medication. It's really important to, if we're helping with cannabis, great. They're using CBD during the day, fantastic. But how are they eating? So we talk a lot about diet. We talk a lot about sleep. We talk a lot about exercise. So generally speaking, when cannabis helps, it can help a lot more if patients are doing some of these things on their own as well.
Yeah, very important that your lifestyle is improved as well. If you want to get better, you can't just consume cannabis and think it's going to work. You have to make incremental changes in your lifestyle. Dr. John Murphy, I would like to talk to you about pain. Pain is a part of all of our lives. And as you pointed out to me in the email, pain and depression are linked. So how are pain and depression linked? What is the effect of pain on mood and mood on pain?
Well, depression definitely hurts. The depression is a disease of the brain where the brain is in decline. Brain cells are actually dying. People don't understand that. They think it's a receptor problem. It has nothing to do with receptors. Okay. So your ability to, say, defend yourself against pain reception might be decreased if the brain cells responsible for mediating that pain are gone or are sick. We don't exactly know why depressed people hurt more, but they absolutely do. So that's the linkage. But people must understand depression.
How do we know that sorry to interrupt. How do we know that depressed people feel more pain?
Oh, I've done thousands of studies, and you simply compare normals to depressed people, and the pain responses are off the chart for the depressed individuals as compared to the normals.
So the question is, what came first, right? The pain or
it's every individual is different. Okay, if you had Lyme's disease, okay, the pain came first, the depression comes later. Right. If you're a football player, the pain comes first, the depression comes later. If you're a 14-year-old kid in school struggling with abusive parents, the depression comes first, the pain comes later. Does this make sense?
Yes, of course.
So we are all unique. We are all unique, and our experiences are unique. And so each individual, when it comes to marijuana, we'll get to that, but each individual has a unique, we have the endocannabinoid system, as was discussed earlier, but we're all unique. So they go together, but not necessarily for the same reason. And not all depressed people hurt, and not all hurt people are depressed.
So what are your thoughts on painkillers, like opioids, for example, that
I despise, I cannot say it strongly enough, how much I despise opiates. Now, yes, there are opiate receptors, but they respond very differently when you're given Demerol or OxyContin than the way the endocannabinoid system responds when you give marijuana. There is no tolerance to marijuana. There's no suppression of the medulla when you take marijuana. There's no addiction potential at these CB1, CB2 marijuana receptors. So I despise opiates. If we can get marijuana to work effectively, I highly support it.
Yeah, that's a big part of what we work with patients on is reducing their opiates because of that reason. So it's a nice option to wean people off their opiates to give them a healthier life.
There's no doubt that marijuana is the single best agent to get anyone off heroin or opiates. Anyone who has an opiate habit or addiction, there is no better way to solve that and help the person off than to use marijuana in a controlled way.
What about Ibogaine? You heard of that?
Yeah, marijuana, nothing touches. Anybody wants to get off an opiate, I can do it with marijuana.
And how would you go about doing that as far as dosages, frequency, things like that?
Again, it's an individual, depends, are they on heroin, are they on oxy, are they on Percocet, how much are they taking? Generally, if anybody wants to do it, the far and away, the single best way is cold turkey. Does everyone know what RSO is?
Yeah, Rick Simpson oil.
Rick Simpson oil. You basically use something like Rick Simpson oil, and you get the person so, can I say, stoned, that they don't even know they go into withdrawal. The big fear on opiates is the horrible withdrawal. So you can snooze somebody for 48 hours, cold turkey, they come out of it, they're off the opiates, and then you can put them on normal doses of marijuana products to control their pain. Maybe it'll take 72 hours in some people. And yes, these are more elevated doses when they're off their opiates for the first few months, but eventually they all come down to normal use. And many, once they're completely off for several months, even get off the marijuana.
So these are individuals with opioids and heroin addictions. Ali, I wanted to talk to you about maybe some individuals who aren't addicted to opioids or heroin, but are just dealing with lower level stuff, anxiety, depression, typical stuff that adults in this country deal with. Have you found that CBD is, let's just put it this way, strong enough to be able to take care of these patients' needs?
They are, but let me go back to the question with the opioids. I just want to mention that Dustin Sulak did an overview, oh gosh, about 2016, and he looked at opiate use and marijuana use, and what he found was that using marijuana with opiates actually make the opiates stronger. So we've been able to reduce patients' opiate use just because when you add marijuana to the mix, you're actually getting more of an opiate effect, and so you can really reduce that opiate pretty quickly.
Ali, I can, before you answer that, I can attest to that because being hurt a lot playing football, at the beginning of my career, I had a significant injury. They gave me opioids. I took them. I didn't like them. I didn't finish the bottle, but I knew that I was in a lot of pain. Later in my career, I had a couple surgeries, and I tried, instead of even taking a full opioid, I took a half an opioid and I consumed a little bit of cannabis. And sure enough, the effect of that opioid really was plenty to help me deal with the pain. And it was just a half of a pill. So it really does work.
Yeah, it's a beautiful thing. So with anxiety, and I deal with a lot of autistic kids who have ADHD, and then moms, you know, and older adult senior citizens. Anxiety is of just rampant in this country, and part of it is obviously the pandemic and what we're going through. Part of it is our stress, and part of it is the toxins that are come into our bodies every day. And so, yes, I've worked a lot with mood disorders and just generic anxiety. And what I find with CBD is that it allows people to feel grounded, and all of this noise that comes in gets filtered out, so you can focus at what's in front of you. So yes, I have very, very good results. And I find that the tinctures are the best, of course, because when you put them under the tongue, those capillaries under your tongue, that CBD that goes right into the bloodstream and bypasses the digestive system. Why that is important? You got quicker onset, you got more concentrated CBD getting into the bloodstream, and then you don't have to worry about digesting something and wondering when's it going to hit, right? Yes, very, very successful with CBD.
What would you say to those who say that you need the whole plant, the THC, the entourage effect to get the benefits of CBD?
Well, the research has shown that the THC receptors get hit in the brain, whereas the CB1 receptors, when CBD comes into the body, the CBD receptors actually start a cascade. Basically, we're jumpstarting this endocannabinoid system. So when we jumpstart this endocannabinoid system, when we strengthen it, that means we start to make our own endocannabinoids. We make THC and we make CBD in the body. When we bring in CBD, it's an agonist to that system. It jumpstarts that system. Now we can make our own THC. So I absolutely, there are definite times where I will send one of my patients off to the dispensary to get a small amount of THC. But for most things that I deal with, conditions, symptoms, disease states, I've been able to accomplish with just the CBD from the hemp plant. There are absolutely certain seizure disorders, certain autistic kids. Again, like Blake was saying, everybody's different. We all say the same thing. Everybody's endocannabinoid system is in a different state of repair or disrepair. So we got to take one patient at a time and figure out how susceptible are they to drugs in particular, how sensitive are they? And that depends, for me, that depends on their dose. And I start everybody off with one drop under the tongue.
And that really requires a hands-on personal approach to each patient that, you know, the mainstream medical apparatus doesn't always have the time or the resources to apply, right? And so it's a one-size-fits-all with these medications, with these pharmaceuticals. Blake, I wanted to talk a little bit about the contraindications to other medications with cannabis. Ali was talking about opioids. What about cannabis and Adderall? What about cannabis and Xanax? What about cannabis and all these other popular medications that a lot of adults are taking? Do you see crossover there? And what are kind of some of the things to be concerned about there?
So when you're talking kind of drug to drug interactions, it's important to kind of distinguish, are we talking CBD or are we talking THC? Because there's different kind of profiles. When it comes to THC side of things, with something like a Xanax or something from that class, the benzodiazepines, there is potential for increased sedation. So that's what can happen when you mix THC with a benzo or something like that. When it comes to kind of contraindications, like can't use cannabis, or at least, you know, if you're following kind of the guidelines, patients with schizophrenia, again, that's more related to THC, because we're learning CBD in good randomized controlled trials can actually benefit some of these schizophrenia patients. So that's interesting.
But THC, to be clear, can kind of kickstart an episode for people who are already schizophrenic.
Yes, yeah, that's the idea. Still, that's actually, per the literature, still fairly rare, but it is at the moment kind of a no-fly zone. When it comes to other drug-to-drug interactions, well tolerated. We have patients in nursing homes that are on a laundry list of medicines and they're taking CBD and THC. But the one to point out, clobazam for the kids with seizure disorders is one that can increase sedation. And if someone's on a blood thinner like warfarin, you may see, because CBD inhibits an enzyme in the liver that degrades it, you might see the INR tick up, meaning you have to lower the warfarin dose because there's a little too much in the system. So really just a couple drugs to be mindful of, and then further sedation with the benzodiazepines.
So could using cannabis instead of those other drugs be effective? Now, no more Adderall, cannabis instead. No more Xanax, cannabis instead. No more Ambien, cannabis instead. Are you a proponent of that?
So that's one of the biggest, like when I'm teaching other physicians, because I do that all over the world, and it's the same questions. And one of my main messages is the reduction in polypharmacy meaning number of medications. That's one of the biggest benefits to using CBD and THC. Some of these patients in the nursing homes are coming off their antipsychotic, their Imovane or their sleep med or Ambien, their SSRI for their mood, potentially a gabapentin or opiates. So sometimes you're able to wean 3 or 4 different medications, which again is another huge plus.
Dr. Murphy, I want to talk a little bit about depression and cannabis. You are a proponent that cannabis can get you off of heroin, get you off of opioids. What if there's someone who's depressed and not on anything? is cannabis helpful for depressed individuals?
Absolutely. Let me also explain. I am a doctor of last resorts. So I am seeing the worst of the worst of the worst when people have given up all hope. Absolutely. And as Blake just said, I don't care if it's ADHD. I don't care if it's an anxiety disorder or depression. Marijuana, if you become familiar with the strains and the contents of each of those strains, you can handpick a certain strain for pretty much any mental disorder and bring about a resolution. Now, depression is probably 20 different diseases. That people don't understand that. It's not one disease. It's.
What do you mean by that?
What do I mean by that? Depression is a symptom. Saying somebody's depressed is like saying somebody with lung cancer has bad cough disease. Depression is a symptom. It's not a disease. So there are many diseases that cause the symptom of depression. Most physicians just don't understand this. That's why some people, if you look at the pharmaceuticals, some people will get better on Prozac, somebody else on Effexor. Well, that's why in the cannabis world, somebody responds to white buffalo and another person responds to Durban poison. They're not, just because two people are depressed, they don't have the same condition.
Right. But you did say, yeah, of course it makes sense, but we're just trying to dig a little deeper into here. You mentioned earlier that you talked about pain and depression. Some depression, you said, is a result of or childhood trauma that may have nothing to do with a disease. So what about otherwise healthy individuals who are depressed? How do you get at that?
What I would do is I would pick, depending if they have what's called an anhedonic depression, they're just not joyful. They see no reason to get out. Then I would pick an uplifting sativa, something like the prior mentioned white buffalo or sour diesel, something to energize them, something to enthuse them, something to make them think differently, like, hey, I can get outside, I can go play that game. So with that type of depression, we're going to give an uplifting sativa. If it's the withdrawn depressed person, the phobic person, they're afraid to go out, oh, I'm injured, people will see me limp, whatever. Then I give them one of the more calming indicas to relax them. Now, just about any strain we can use, if it has the right terpenes, just about any strain can decrease the pain. So it's the actual mood effect. Is it a frightened, depressed person? Is it a de-energized, flat depressed person? One will get this sativa with the right terpenes, and the other will give an indica with the calming terpenes to get them the ability to go outside and not feel afraid. Again, it's so individualized.
Yeah. I want to talk a little bit about pain again, pain management with cannabis. So as a football player, as an athlete who got injured a lot and tried both pain pills and cannabis, to me, whereas pain pills literally did kill the pain, you don't feel it. You still feel it with cannabis. It just reframes it in a way that allows it to be more manageable. Is there any kind of technical way of explaining why I had that sensation, that I was still aware of the pain, still facing the pain, but just not swallowed by it?
All right. If you look at the endocannabinoid system, there are basically two known cannabis molecules made by the human body. One, anandamide, is in the brain. That gives you the feeling of bliss, gleefulness, happiness. So if you were to inhale sour diesel, you get a sense of bliss in the brain. Well, bliss counters or distances you from the pain. And then the terpenes, if it has myrcene and other pain-killing terpenes in it, you actually have less pain, but they don't kill the pain the way an opiate would. Thus, the patient reports they had the pain, but they don't care that much. They're distanced. Does that make sense?
Yes, it does. Yes, it does. Blake, do you have anything to add to that about specifically the difference between sativa and indica in your practice, and the luck you've had prescribing those different strains to people?
I'm not particularly like the biggest indica sativa guy. I'm more focused just on the milligrams of CBD and THC. It's kind of one of these things where the plants have been so hybridized over the years that at the DNA level, the genetic level, there are actually a lot of these things that are mislabeled as indica or sativa because there isn't any regulation. So whereas like with John saying, individuals trying different strains, that's kind of more what I'm into, trial and error, as opposed to the kind of the classic indica sativa nomenclature.
Got it. I know, Ali, you deal with CBD, and so is there kind of a difference between different strains of CBD and the way it handles or the way the body handles it?
Well, sure. I mean, hemp is now being grown for its terpenes as well. So, for instance, I have developed a CBD strain that's naturally CBD, CBG, and a few other cannabinoids, but we've added some very specific terpenes to it to create an antiviral, anti-inflammatory part to this CBD. So the terpenes are absolutely important and essential in many things. In fact, we know that there's a really important terpene called beta-caryophyllene, and they actually think it's a cannabinoid, but that beta-caryophyllene is actually our CBD receptor agonist. It turns on our CBD receptors. So it behooves us to have beta-caryophyllene, for instance, in our tincture, for instance.
It's also anti-inflammatory, the beta-caryophyllene, which is nice.
Absolutely. You can use it as a pain reliever topically. In fact, the physician that I work with has a beta-caryophyllene vape pen that is working really, really well for eye issues, for many other issues. But beta-caryophyllene is one of these terpenes cannabinoids that's starting to become really popular. Yeah.
Okay, so I know we don't have a ton of time left. I do want to get into somewhat taboo subject about children and cannabis, and how we go about dealing with the mental health issues of children when it comes to cannabis, and whether to prescribe it, how to react when we catch them with it, what it is doing to kids, to teenagers, what the way the cannabis market is marketed to these kids, how is that affecting them? What I'm hearing from all of you is that there is a dose of cannabis that could work for everyone in every type of situation, but how do we get that information to parents, to kids who might need it? Ali, maybe we can start with you. What are your thoughts on CBD for children, for example?
Well, the beautiful thing about CBD for children from the hemp plant, again, we don't have to worry about the psychotropic, the THC part of it. And, my point with children is that, we all have an endocannabinoid system. For children who have ADHD or some disease state or condition, many times this endocannabinoid system is not working or is working poorly. So CBD, because it doesn't have the THC, I don't really worry about that issue. What we're worried about is, or what we're trying to do is, we're trying to jumpstart this endocannabinoid system with CBD. So for children, I've got Tourette's kids who are doing wonderfully, ADHD, autistic. I deal with a lot of kids, and I've never had a problem because we start really small dose. I take an intake, and most of these kids already have gut issues, and we know that if you've got brain issues, you're going to have gut issues. If you have gut issues, you're going to have brain issues, or something called the vagus nerve that communicates this back and forth. And our CBD receptors are located in the gut, in our immune system. So it's all very, very connected. But with children, again, I just start slow. And then what we hope to do is we hope to see a result. CBD gets the kids to be less reactive, a little more calmer. Maybe their focus is a little better. Then we might be able to get them to change their diet a little, reduce their carbohydrate intake, maybe try to reduce some of the pharmaceuticals that tend to be the problem long-term. And Dr. Murphy will tell you, all these pharmaceuticals are meant to be short-term. They're not meant to be long-term. So if we're talking about kids, start with plant medicine. A plant, this amazing plant, boosts or brings up the endocannabinoid system. It boosts our system. It strengthens our human body. Pharmaceuticals are a synthetic molecule used to suppress some pathway in the body. Long-term, that's a bad thing.
Are there any pharmaceuticals that are good?
There are pharmaceuticals that are life-saving, but I want to point out, since children were mentioned, I was one of the only doctors in the country approved to test these psychotropic drugs in children. The results were appalling. I refused to continue the testing and I shut down all the studies, much to the chagrin of the government and to Harvard, who continued to promote these drugs in children.
Which drugs are you talking about specifically?
Any of the SSRIs, SNRIs, the antipsychotics, Abilify, Effexor, Zoloft. Harvard promoted, now I'm going to nail Harvard on this because many kids have been destroyed by taking these drugs at a young age. I did the studies. I saw what they did to the kids. Marijuana, I've never seen that. I would gladly put a kid on low doses of cannabis over Adderall, sertraline, Zoloft, whatever you want to call it. I did the actual research and the results are clear. Marijuana safe, psychotropic drugs in children, with the exception of Adderall and Ritalin, can be very dangerous and detrimental to the development of that brain, that young brain. So sorry, but I feel very strongly.
No, this is very important. So are you saying that THC is not harmful for a developing brain?
Not if used intelligently. If you have a 10-year-old kid going out and getting stoned every night, the development of his brain is not going to be normal.
What if you got a 16-year-old kid who's doing that?
Not normal. The brain continues to develop through the age of 25 or 30. Anything, you don't really want to alter it. We want everything in balance. So, for example, a 14-year-old kid, if he's highly stressed, some marijuana could be very beneficial. Bring him back in balance gently. He doesn't have to take Xanax. He doesn't have to take these other drugs. Does that make sense?
Of course. Yeah, that makes sense.
So there's a way to use marijuana, but it's another drug and we have to use it as a drug. We have to keep in mind it too can be abused.
So how do you convince people who are cautious or suspicious of its efficacy as a drug that it is safe when there isn't really, or at least there doesn't seem to be, as much data around it as there are for other FDA approved drugs?
Well, I actually possess the data that shows the drugs are dangerous in kids because I did the studies. So I know, and I have proof from the clinical trials that we can damage kids giving SSRIs and similar. All right, so is it in the books? No, but I have it. Now, do I have that marijuana doesn't do it? No, we're not allowed to test. We're not allowed to do it. But in my practice, I use it. And so far, I only see benefit. I haven't had a problem using marijuana in teenagers or even younger. The only kids under 10 in which I've used marijuana are children with seizures. I haven't had to treat any mental disorders under 10. But I haven't seen any problems of using marijuana judiciously in children.
Dr. Blake, what do you think?
Yep, I would agree. Like if we're talking, when we're talking pediatrics, generally speaking, yeah, you have to have a diagnosis, right? Like we treat a lot of the kids with the rare epilepsy syndromes, so certainly makes sense. I agree that like a 10-year-old consuming a large amount of THC is going to be some abnormal development in the brain when you use it in those high doses. So we stay away from that. But we stay away from high doses of anything in general in medicine. To John's point, it's all about balance, right? So when it comes to kids, severe autism, yep, we'll help them. Rare epilepsy, yes. Moving to more ADHD, getting away from some of those psychotropic medications that John mentioned. Some of these kids with autism are on even antipsychotic medication.
Not good. Not good.
No, terrible. So, if we're comparing cannabis to an antipsychotic, yes, cannabis for safety gets the win. But also with the peds population, when you're talking like mental health, whether it's ADHD, anxiety, a lot of parents hear a lot about CBD and THC and they want a quick fix. And it's so important with kids that you really do the history with the parents, really drill down on kind of their parenting and what's happening at school. What are they feeding these kids? A lot of the time their diets are so bad that just eating some nutritious food can improve some of these ADHD symptoms. So there's benefit, but it's certainly not kind of the quick fix.
Okay, I'm going to pose one more question to you guys. And then after that, we're going to wrap up and you can do any kind of closing statement or anything that I didn't touch on that you'd like to touch on. But this last question, so what would you say to, let's say, a 29-year-old adult in America, because it's a little different in America than Canada, the access to cannabis, but a 29-year-old American who's dealing with some chronic pain issue, who has a propensity to medicate, has dabbled in opioids, takes Ambien to go to sleep, and maybe Adderall during the day. How would this individual go about researching, finding the right way to use cannabis to get them off these other medications and control their mental health? Allie, you can start.
Since I'm the only non-doctor here, for me, I think somebody like that, I always ask if we can work with their doctor, because when you're taking somebody off of anti-anxiety or some of these really big bad drugs, you have to do it very carefully, very slowly, and methodically. And certainly that's not my purview, but for me, I always start somebody, I always do a large intake, see how sensitive they are, have they had cannabis before, and then always during the day, if we can get somebody out of their fight or flight, we can reduce some of those daytime drugs pretty quickly and pretty easily. So it's a one-on-one total intake, figure it out, and then from there, we definitely got to look at their diet. Did I answer the question?
Absolutely. Yeah. Blake?
Yeah, same kind of idea, like working with your healthcare provider, because we're talking, medical conditions and weaning meds. So like Ali said, and coordination there makes good sense. If that was, let's say, a patient of mine, we'd want to talk about getting off the Ambien at night. We'd probably use something with THC for sleep. And then during the day, depending on the symptoms, probably maybe something with CBD, depending on if they're working, they're driving, how they're functioning for their ADHD is concerned, or if they had associated anxiety. But that's kind of like the cannabis medicine portion. And then, like Ali said too, addressing, okay, what's going on with the diet, what's going on with exercise. That's how I would do that with the patient. If they're in the US, then they would go to the dispensary and pick up those products, or maybe grab some of Ali's CBD.
John.
Okay, this is right down my alley where I say I get the desperate people. So here you said what? They're taking sleep meds at night, and they're taking some type of uppers in the day to get by, right?
Yes, sir.
I'm going to need some significant marijuana to beat that. So let's see, for nighttime, we can just get them some 9-pound hammer. And if I have them eat a little bit of it an hour before bedtime while smoking a little bit or vaping before they go to bed, the smoking and vaping will put them to sleep. The edible that they ate a couple hours earlier will keep them asleep for 6 hours. Goodbye Ambien, goodbye whatever sleeping pill you're taking. 9-pound hammer or Granddaddy Purple will take care of it. Now, for your upper during the day, you're dragging a little bit. Well, it's what we would use to treat somebody. Same thing what we give to the ADHD person. A nice sativa, and don't laugh at the name if you're not familiar, but Trulieve actually sells it. Green crack will keep anybody awake during the day, as will sour diesel. But green crack, if you have ADHD, use green crack. You don't have ADHD and you have plenty of energy. Doesn't slow you down, keeps you focused. It's amazing. So when you have somebody on drugs, you have to give them, marijuana is 400, 1,000 different drugs, and it helps to know them all because you can pick a strain that's for ADHD, for OCD, for this depression, for that. And so I could get a person off of both of those drugs using 9-pound hammer at night, either green crack or sour diesel in the daytime, and they'll gladly give up their pills because they get a little bliss with the relief instead of just drug effect.
Yeah.
So and who doesn't want a little bit of happiness?
Right. Yeah, we all need that. We do need that.
We all need to be happy. We all need happiness.
There's no shame in feeling good. And a lot of times the knock against cannabis is that, is medicine supposed to be fun? Is medicine something you can do with your friends and laugh? And typically it hasn't been that way, or at least not in Western medical circles. So there is a bit of a leap to take mentally when you're thinking about that. Okay, so as we wrap it up, any kind of closing statements or things I didn't touch on that you guys would like to mention?
Well, I'd like to segue on that last point, Nate. The endocannabinoid system is actually toned or strengthened with things that that doctors, Western medicine can't quantify. So, for instance, music, connection, community, love, all of those things strengthen our immune system. Green tea, omega-3s convert into CBD in the body. So we actually have an amazing body. We just need to feed it the right supplements. And CBD, I feel, is the superfood that turns this system on, that helps the immune system. We can overcome a lot. And I would also say that a lot of these mood disorders, anxiety, depression, have not only maybe a blip on the DNA, but there's also a factor of inflammation, whether it comes from a toxic chemical or whether it comes from everyday stress or something we ingest like our food additives or grains. So it's all combined and it's all connected, but plant medicine is all about getting back to the plant, the earth, the energy of the earth, the energy of this plant. The energy of our body is the same exact energy of the earth. And we're meant to bring this plant into us for our healing and for our benefit and good health.
Well said. Blake, anything to add?
I would just say maybe where I want to see things go in Canada and the US is we talked a lot about lowering opiates, and that happens. But you know what happens to these patients, unfortunately? A lot of them will go back to opiates because these are the medications that are covered by insurance companies, big like Medicaid, Medicare, in Canada, provincial drug plans. So I have a lot of patients that get benefit, but then have to go back to these drugs because they can't afford to cannabis because it's not covered. So that's one thing I'd like to see change in Canada and the US. There's a Covered Cannabis project, which I started, which is basically trying to raise awareness for this issue. So just wanted to mention that, and hopefully all of us together, you know, we can keep spreading the word to get coverage. And then lastly, as far as change, I'd like to see the national sports leagues, all the pro leagues get on board, start educating the team physicians, having the former athletes maybe speak to the team physicians, but we need it to change in pro sports as well. And if anybody's watching and wants to chat with any of these organizations, again, let me know, because those are the two things that I'm pretty passionate about these days.
Awesome. John?
Oh, I would like to address what you just said about, when maybe we're not allowed to have fun, or maybe no, there's nothing more important in life than enjoyment, happiness, satisfaction, just having fun. So anyone who doesn't think it's okay to get a little THC into your head to lift your mood is being foolish. There's no reason to live in this world and be unhappy or to suffer. There are solutions, and I want people to know there are very safe solutions. And joy is what we all want. Happiness is what we all want. We ought not fear it. So, Nate, I just wanted to say, yeah, happiness, let's go for it. I think the world will be better off.
I agree with you there. Happiness is a great medicine. Laughter is the best medicine. They say that. It's a cliche. Sometimes they say cliches because they are true. We want to thank everyone for joining us today. It was very informative. We could always also, we could talk about this for hours, but I think this is a good place to start with cannabis and mental health. Ali Stoddard, I want to thank you. I want to thank Blake Pearson. I want to thank John Murphy for joining us. This video will be available. It'll be emailed to those participants who are watching today, and also will be available on the A4C website. Again, we want to thank Trulieve and A4C and all of our awesome panelists. Thanks for joining us today. We hope you learned something, and we'll see you next time.
Thank you.
Thank you.
Thanks, guys.